So meeting the patient's families is extremely not only rewarding but also helpful. When you take care of somebody, you're really taking care of the whole family, and that's something that's very appealing with cardiology and medicine in general. I had a lot of contact with physicians growing up. I was always struck by the relationship the physician formed, not only with the patient, who was my mother, but also with the rest of the family. And so I really learned a lot from that and was really influenced by that. Over the years, my interest in science blossomed, and I also, though, felt a great need to want to work with people and help people, and so the two combined, the natural fit was to become a physician. And what drew me to cardiology was the ability to not only take care of people when they're sickest and most scared, but also the ability to play a role in prevention. Specifically, I have an interest in diet and nutrition and its role in prevention. I like working with people. It's what drew me to medicine in the first place. It was, in addition to the love of science, but the real people part of it, the ability to work with people and help people, really drew me to medicine. Well, I was born and raised in Massachusetts, and so I was very excited and interested by the ability or possibility of continuing to work in the Massachusetts area. Well, what drew me to Pentucket Medical was the fact that every person I interacted with or met was not only extremely nice but very helpful, and it seemed clear that it was a very people-friendly atmosphere. I think it's important for a physician to really become embedded in the community and not only just work in the office but also be visible through the community, educate as many people as you can. Customer service is very important to me. I think over the last several years of my training, I've come to really appreciate that. Several mentors have really instilled in me the fact that availability is an extremely important part of medicine. Not only is one's ability or affability, but availability is certainly a very important thing, and that's something I really want to strive to achieve, to be available to not only my patients, but also to be available to other physicians in the community, to answer questions at any time or to help out with anything. During my training over the last several years, I've really come to appreciate is the need to not only communicate with the patient, but certainly to communicate with the referring physician. And I've really come to learn that the availability and service aspect of things is very important, just as important as the connection and bond you form with the patient. Yeah, I think it's very important that patients form a close relationship with their primary care physicians. And my role as a cardiologist is really to form a team with the primary care physician in taking care of the patient and their cardiac needs. So many patients are often facing surgery, and it's a real big new thing for them. So it's my job to not only diagnose what they have, but also educate them and teach them about what the latest and newest modalities out there are.